Okay, this is part 2, and part 2 is going to focus on inhalers, metered dose inhalers and aero chambers. And so I just want to spend just a little bit of time talking about technique and how to get a really good treatment with a metered dose inhaler. I'm sure everybody's familiar with inhalers and what they look like, and I'm sure you've probably either seen people puff it and go, puff and go. But I want to talk for just a second about technique with a spacer or an aero chamber. So this is an example of a mouthpiece aero chamber. Voila. And on this slide, it's the same one. It's the same as this one. So these, even though they're not identical, they work the same. They both are mouthpiece aero chambers. This is an example of a mask aero chamber. So this would be like for a patient who was, 6 months up to age 5. That would be fine for that use. And this would be for someone who could really follow directions and understand how important it is to breathe in slow, deep with an inspiratory hold. So if they really couldn't follow directions with that, then they may need a mask. And so even though I don't have an adult mask aero chamber up here, those are available. Alright, so inhalers. They come out fast, and I'm going to pump it, and you won't be able to see the mist, but I just want you to know that it shoots out really, really fast. Sometimes people measure things like how fast does inhaler come out of canister, and it can be over 100 miles an hour. And so when you see a patient go like this, boy, they have to breathe in fast to catch it. And a lot of the medicine goes in the mouth, and the intention is for a lot of the medicine to go into the lungs. And so how do you slow that down? How do you really get a lot of that medicine into the lungs? And that is with the aero chamber. So, aero chambers are cool. This one has a fancy word in that it's non-electrostatic. And you can see on this one too, it's a non-electrostatic. That just means it keeps the medicine from sticking to the sides. It's a holding chamber. It's called a spacer because it holds it in space. So the intention is inhaler goes in the back. Shake it up, blow your air out. Make sure the top cap is off, right? Then you're going to put it in your mouth, press down. Now watch my breath. Is this going to be fast or slow? Watch. Slow, deep breath, holding for 10 good seconds. And then let it out. That's good technique. And why is it good technique? It's good technique because the lungs like slow air movement. They don't like fast air. Remember, fast air gets a lot of medicine in the mouth, but a slow air, slow deep breath gets more medicine into the lungs. Now wait 1 minute and do it again. So we'll wait 1 minute and repeat. Shake up, blow air out. Spacer in mouth, press down, ready? Are you breathing with me? Here we go. Slow, deep breath all the way in, deep. Now hold it for 10 seconds if you can. Keep holding. And let it out. And that's how to really use the aero chamber with the metered dose inhaler. If you're using the mask aero chamber, this one, if you have a little one that you're using the mask aero chamber with, the technique is a little different. So let's just pretend. You have to use your imagination that this isn't a mouthpiece, but it's this mask, this yellow mask here. So it's similar. Inhaler goes in the back, shake it up, and then over baby's nose and mouth, press it in. This part is soft, so when you press it in, it makes a nice seal. You press down 1 time, and as the child inhales and exhales, this is a one-way valve. It opens and closes. You can just count about 7 breaths, and that's enough breaths to get all the medicine out of the chamber. And all done. That would be considered 1 puff. And so if it was prescribed to be given 2 puffs, wait 1 minute and repeat. Shake it up, over baby's nose and mouth, press it in to make the seal, press the pump down, and then count. So you can either count chest rise for about 7 breaths, or you can count this exhalation valve opening and closing about 7 times. And then one addendum on that is that sometimes children like to move, and so if that baby moves, that seal is broken. But it's a holding chamber, excuse me, it's a holding chamber, remember, so it's held in there. So you just put the mask back on and pick up counting right where you left off. All right? So that concludes how to use an aero chamber with a metered dose inhaler.